Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It is 3/13/2023. It's Monday morning, and we're all good, and I certainly hope and pray that you're doing good. Let's go ahead and talk. Let me go ahead and give you some clinical pearls here, and then we'll keep going. So, one of the things that I want to talk to you about is osteoporosis. Now, osteoporosis is the loss of bone structure, usually associated with aging. Okay, and what it does is it makes our bones more brittle, easier to break. It's way more prevalent in women than it is men, but both men and women have it. The way we test for it is through a DEXA scan or a bone density scan, in which we look at your back and your hips, and we try to determine whether or not you have an adequate bone density. And with lower bone densities, we know there's an increased risk of fracture, and it's reported out as a T-score. And a T-score has to do with statistical variations, but basically, if your T-score is less than 2.5, then you have the diagnosis of osteoporosis on your bone density. And usually we recommend treatment for that. And the reason we want treatment is to prevent you from having fractures. And we know as you get older, fractures can be more and more deleterious to your overall health. We also know that they're a big source of pain. And of course, we all know that when we have a friend or somebody who's much older and they break their hip or something, they usually don't recover that well from it. And about 25% of people who break their hip will be deceased the next year as on average related to that hip fracture. So we do offer treatments. I do the oral treatment, which is bisphosphonate therapy. And that was the highlight, the big thing for many, many years. However, I will tell you that there's some controversy that we have to deal with on it, having to do with jaw necrosis. We've got other ways. You've got shots you can take, like the Prolia shots. I do the Prolia shots, but I'm not that big of a fan of them. And that's, if you ever want to talk to me about that, I'll tell you in the office why. We got reclast injections, which is a bisphosphonate that's just given intramuscularly. And the problem is the bisphosphonates all have the same issue with the jaw thing. The Prolia doesn't, but everything else does. And then there's another way we can treat you using synthetic PTH, which is another shot that we have to give. The problem with that is it's actually the best and it's the least negative side effects, but it usually isn't affordable. So if you're interested in osteoporosis, if you're over 60, we definitely are going to talk to you about getting a bone density scan when you come in for your wellness. Insurance or Medicare pays for them about every 2 years. So if you think you have bone density, or your mom or dad had osteoporosis and you're worried about it, come see us and we'll talk about it and we'll try to figure out a decent plan for you. I do know we do the BioT, which gives everybody testosterone. That's really effective with helping with osteoporosis as you get older. So the other thing, everybody, like last week, it seems like there was a bloom of something. A lot of people had immediate intranasal congestion and an allergic response to this. Remember, we talked about the sinus rinses. But I also want to let you know that we have allergy testing here. So if you want to identify what you're absolutely allergic to, we can help you with that. And that helps with the management of it. And we also do the shots if you come up positive for things. And that's an old tried and true method of helping people deal with their environmental allergies. And it's very effective. And we do those here if you're interested in it. We know the pollen's out and around, and honestly, with a lot of this stuff, you don't even have to be allergic to the pollen to have a reaction to it. So just an FYI, keeping your nasal patches as clear is about the best you can do to combat that stuff. The last thing I want to talk about, we got those weight loss shots. We've done really well. And one of the things people, we're seeing patients before we start the shot. So one of the things that we are doing is for a lot of the commercial insurances, not all of them, and we don't know which ones do or don't, but there is some that will pay for it through the insurance company. So one of the things that we do when you come in for your initial visit is to see and to try to get it paid for by the insurance company, because it's a lot cheaper for you if you can get it paid by the insurance company. However, I will tell you that it's not that successful in getting that done, but it is some. And to the best of my knowledge, the government plans don't really cover it. We haven't had any success in getting those. But if you are interested in the weight loss shot with the semaglutide, you can, when they come in, you can say, hey, I have commercial insurance, and we'll absolutely look for you and try to see if we can get it paid for. Otherwise, we have our own payment plan, and it's much cheaper than, even if you have to pay some on it, it's still in the hundreds or thousands of dollars sometimes. So we have a much affordable way for you to go by it if you have that problem. Alrighty, it is always a pleasure to talk to you. It's always a pleasure to see you here in the office. I really appreciate you listening to me. It means a lot to me because I can get some really effective communication and help people, hopefully on a bigger scale than I do minute by minute in here. Thank you so much. I want to remind you that me and my team are ready for you if you have a problem. 706-782-0016, and we will accommodate you as rapidly as possible with anything you need. Thank you so much for listening. Have a wonderful day. Talk to you later.